This picture clarifies the auscultation areas for the cardiac system. The pulmonic area, which is located in the second intercostal space left to the sternum. The aortic area, which is located in the second intercostal space right of the sternum, ribs, point, second, third, fifth intercostal space. The tricuspid area, fifth intercostal space, left side to the sternum, and the very important area, which is the apical area and called PMI. يعني PMI, point of maximal impulsation, that's located at the fifth intercostal space mid-clavicular line. The S1 is clear at the apical area, and S2 is clear at the base of the heart, which is the second intercostal space right to the sternum. Very important to assess the capillary refill time that may be impaired among patients with congestive heart failure, hypertension, and this time could be decreased and indicate a decreased blood perfusion and blood supply to peripheral body parts. The presence of hematoma, which is a large bulge or collection of the blood under the skin. بعض الناس اللي بيعملوا سيرجري أو كاف وهي قسطرة شرايين القلب ممكن يصير تجمع الدم في منطقة الفيمورال area نتيجة bleeding from the femoral artery. Vascular changes. ممكن نعمل اسمها peripheral edema, ulcers in the lower extremity. Very important to do the physical exam for the lung. We can assess tachypnea among patients with pain, anxiety, heart failure. Chinese stick breathing, which is abnormal breathing pattern that may occur among different type of patients. Pulmonary edema. Brain disorder also may report, patients with the brain disorder may report Chinese stick breathing. The presence of dry cough, crackles, الخشة اللي بنسمعها خلال نتيجة accumulation of fluid around the lung, crackles and wheezing اللي هو الصفير، والصفير ينتج عن passage of air through narrowed airways يعني مرور الهواء في وعاء متضيق. Abdomen, hepatojugular reflex, and we have to assess bladder distension. May indicate fluid retention inside the body. Risk factors. Risk factors العوامل الخطرة. شو هي العوامل اللي بتزيد من حدوث أمراض القلب أو أمراض تصلب الشرايين، أو ما هي العوامل التي تزيد من حدوث الجلطات القلبية بنسميها risk factors. We can classify the risk factors either to non-modifiable and modifiable. Non-modifiable you cannot modify, you cannot change, and the modifiable you can modify and you can change, so that you have an active role in controlling all of the modifiable risk factors. The non-modifiable age. As your age increased, the risk of cardiac diseases increase. Positive family history, the one who have a parents, mother or father who have hypertension, hyperlipidemia, acute MI may have increased risk to have a cardiac disease. يعني الإنسان اللي عنده أب أو أم مروا بأمراض تصلب الشرايين أو الجلطات القلبية أو الضغط أو السكري، ممكن هو يكون عنده أحد هذه الأمراض بحيث يزيد من حدوث أمراض القلب. Race العرق، عادة السود black higher risk than white. Gender male higher risk than female. However, this risk may be equalized at specific age, menopause age. Modifiable risk factor hyperglycemia اللي هي ارتفاع مستوى السكر, as the patient with diabetes have higher risk to develop cardiac disease more than the patient without diabetes. Hyperlipidemia, increased level of blood cholesterol may lead to atherosclerosis, يعني ارتفاع مستوى الدهنيات يؤدي إلى تصلب الشرايين وبالتالي يؤدي إلى زيادة حدوث أمراض القلب. The most significant and important risk factors that may lead to cardiac diseases is the hypertension. أهم وأكثر عامل يؤدي إلى تصلب شرايين القلب هو ارتفاع ضغط الدم. Inactivity, الخمول والكسل, اللي هي sedentary lifestyle. Smoking is a very dangerous risk factor. Obesity, insomnia, type A personality اللي هم الامبيشس القلقين المتوترين اللي بدهم كل شيء يكون عندهم. All of these factors, the modifiable risk factors, could be modified, could be changed. You can control your blood glucose level, your lipid blood level, blood pressure level by doing exercise, taking your medication, doing healthy lifestyle, diet الحمية, and by doing exercise, quit smoking. Obesity you can control it by healthy diet, type A personality doing stress releasing technique. Cardiac enzyme presented inside the cardiac cell and could be released from the injured cell when there's a ruptured cardiac membrane. إذا هي موجودة داخل خلايا القلب، لكن لما تصير في دمج لخلايا القلب بتطلع وبتروح على الدم وبرتفع نسبتها في الدم، ناخذ عين الدم من المريض ونلاقيها مرتفعة. Some of the enzymes are not specific for the cardiac cell, others are specific. The cardiac enzymes that are specific, the CKMB is the specific cardiac enzyme. We have the CK, or the CBK, نسميه creatinine phosphokinase. The CBK has 3 أنواع, 3 isoenzymes. The specific for the cardiac muscle نسميه CBKMB. في CBKMM for the muscle and CBKBB specific for the brain. In addition, we have the lactic dehydrogenase, LDH. It's not specific for the cardiac cell لأنه أيضا في 5 types منه. The injury in liver and spleen and pancreas could be lead to increase in lactic dehydrogenase. شو معنى lactic dehydrogenase؟ انتم بتعرفوا أن lactic acid could be composed in case of decreased ATP or in the absence of oxygen. واللي بيصير عند مريض الجلطة القلبية بيصير في decreased blood perfusion, decreased oxygen supply, so that the lactic acid may result. The most specific cardiac enzyme that may indicate a cardiac damage or acute MI اللي هي الacute myocardial infarction اللي هي احتشاء في عضلة القلب أو الجلطة القلبية. أهم cardiac enzyme هو troponin I. في troponin T أيضا specific and indicate a cardiac damage.